Good evening all. Thank you again for coming. This evening we're reporting 20 new cases of COVID-19 diagnosed since we spoke to you last, bringing the total in this country to 90 cases. Of these new cases, 6 of them are associated with travel, 12 of them are associated with contact with a confirmed case, and 4 of those are healthcare workers. And there are 2 where we haven't been able to identify a link, bringing the total thus far that we haven't identified links for to 7. We've had 6 people in ICU and sadly still have reported 1 death. Across the world, there's now been 132,536 cases diagnosed with 4,947 deaths across 123 countries. In Italy, the number has increased today to 15,113 from 12,462 yesterday. In Spain, the number is now 2,965, increased from 2,140 yesterday. In France, the number is 2,860, increased from 2,281 yesterday. In Germany, the number is 2,369, increased from 1,567 yesterday. And in the UK, the number is 798, increased from 590 yesterday. In terms of items to update you on, the National Public Health Emergency Team met again last night, as we told you we would. We approved new guidance in relation to self-isolation at home for confirmed cases where it's clinically appropriate for that person to do so. And that's a significant change in the sense that it will remove the requirement for a person who's a confirmed case to go to hospital unless by reason of clinical health. We've changed the case definition to apply for the assessment of a case. And to remind you, previously the case definition had 2 components, both a geographic component or contact with a confirmed case, as well as a symptom component. And the case definition now will simply be a clinical assessment of symptoms without any reference to geography. We've also provided some guidance in relation to the requirement going forward for people returning from the areas that are the subject of travel advisories on the Department of Foreign Affairs website to restrict movements on return for 14 days. And we've increased and changed some of our messaging at the airports to provide for that and to raise awareness for people, and you may well have seen some of the postering that we've provided in relation to that, of the range of measures that are now in place in this country for anybody coming through the airport to see. There was a meeting of the Health Security Committee today. It was part of our general activities, and there will be tomorrow a meeting, a North-South meeting involving both the Minister and others and my counterpart and myself to consider issues relating to COVID-19 on the island of Ireland. So that's the update for today. We're happy to take any questions. So we'll be sharing, if you like, both our observation of the experience of the disease and how we've responded to that, and continuing to work together as we have done. We've had ongoing regular contact at official level, both from the department and from the Health Service Executive right since the very beginning of all of this, and there's been frequent engagement between the 2 ministers for health over the course of all of this. And this is an opportunity we're taking to have a face-to-face engagement to discuss, as we've been doing since the beginning, the ongoing assessment and the ongoing management on the island. I'm having a little difficulty hearing you without a microphone. Sorry.
Apologies. Is it problematic having schools closed one side of the border and not in the other? I mean, is that something that you'll be raising? And are there indeed problems with that?
So we're discussing, if you like, our approach. They'll be discussing, I'm sure, their approach. We recognise there are differences. The arrangements we have in this country, we're happy are the right arrangements for now in terms of schools.
Tony, just in terms of the case definitions now and
Yes.
eligibility for testing, some people today despite the fact that the new eligibility for testing was announced earlier on. Some people say that they have been in contact with the helpline or with their GP and say that they still aren't eligible for testing. Is there some sort of a delay happening there, or is this just a normal sort of lag, or is this to be expected?
So I'll ask Dr. Cuddihy to expand in a moment, but I would say that the step that was also part of the assessment we would have explained on a number of occasions, whereby a GP, for example, had a patient and was making an assessment and felt that that might be a case of COVID and wanted to test, there was a requirement to consult a public health doctor, and that requirement will no longer be part of the process. But I'll ask maybe Dr. Cuddihy to expand on the guidelines that have issued to provide for that.
Just today, the algorithm for assessing patients with a new case definition has been issued out to the GPs across the country. And the algorithm is now based, as Dr. Houlihan said, on clinical symptoms of recent onset of fever or chills and or signs and symptoms of respiratory tract infection, which includes cough. And the basic advice is still the same, that someone phones their doctor if they're concerned. They do that rather than turning up in person, and the doctor will use clinical judgment as well as this algorithm that we've provided, and then be able to arrange the testing via the National Ambulance Service. The key information of self-isolating at home for that patient also stands. And I suppose a change now as well is that patients who are suitable can continue to self-isolate at home rather than necessarily being admitted to hospital. The assessment is done to see if they're medically fit to self-isolate at home, and secondly, if their environment at home is amenable to self-isolation.
Is there, just in terms of when people phone the helpline or phone their GP, how long will it be if they're deemed fit to be tested? How long is that going to be generally?
The current waiting time for the testing with the National Ambulance Service is, it can be up to 24 hours at the moment, but that's being upscaled at the moment, and we'd expect that as well with the new change now that the GPs will have direct access to requesting the testing, that the turnaround times will shorten.
Can you clarify the advice on social distancing? Obviously pubs, cafes, restaurants, some of them are open. Is the advice people should avoid socialising in general, even if they're in low-risk groups, for the next foreseeable future?
So for the period of time that we've identified, the advice in relation to that kind of activity is to reduce in as much as possible discretionary social activity. So some of those examples that you identified there fall into that category. We're not telling pubs or restaurants to close. We think we have, as I've said before, plenty of anecdotal evidence and of examples of restaurants, for example, that have been able to accommodate to the social distancing requirements and still provide a service to customers. The key thing that we're trying to achieve here is not necessarily that every person follows, stops every form of social activity, and that would be like lockdown as has been characterised in some parts of the media today. What we're looking for is that the majority of people reduce the majority of their social interactions. We think that's the thing that will have both significant effect in helping to push the wave without, let's say, unduly and totally reducing people's social activities.
And could we see the advice being updated to say don't socialise? Is that a possibility if these measures don't succeed? So
what we'll do is, as I've said before, continue to monitor both the disease and its course and the impact of the measures that we have mandated and recommended, both in terms of their impact on the course of the disease and wider impacts, and we'll continue to evaluate whether they need to stay in place, to change, and we'll provide guidance and advice on an ongoing basis. But we don't anticipate any change in relation to that in the time period that we have identified up to the 29th of March.
Stephen Murphy from Sky News. Can I just ask you, the 4 healthcare workers, are they associated with treatment of one case?
No.
Okay. And is that a concern to you now, given that, you know, frontline staffing numbers are so tight anyway, that we may now see more of our healthcare workers become infected?
I'll ask Dr. Glynn to address that, yeah.
Sure. Of course it's a concern for us that any healthcare worker has contracted COVID-19. We're acutely aware of the risk and the concerns that healthcare workers have, and I think we have to reiterate again and again our gratitude for the work that they've done in preparing over the past number of weeks, and that now they continue to do in what is an exceptionally unusual scenario and environment for them. So yes, of course, we're concerned about every single case, whether it's a member of the general public or whether it's a healthcare worker. But it re-emphasises again the fact that the importance of PPE, the importance of respiratory etiquette, hygiene, but that's a message for the entire population. So yes, every single case is a concern.
Fergal Barrows, RTE News. Can I ask Dr. Houlihan, Cheltenham has ended after 4 days. There was one case in Cheltenham town, we know, earlier in the week. What are you saying to race goers who are going to be returning here over the coming days? Because there's an estimate of about 15,000 Irish people over there, mixing quite closely. Is there a risk, and will anything happen, those individuals, when they come through the airport? Will they be approached? What information are they going to be given?
So they'll be given the information that we've given in relation to returning travellers all along. They're not coming from one of the areas that have been identified in the travel advisories. We will be giving them advice about the nature of symptoms, about what response that they should have in the event that they experience symptoms, to stay at home, to self-isolate, contact a GP if they have symptoms. But we're not issuing advice to people to restrict movements if they have no symptoms.
And Dr. Glynn, can I just ask you about some of the confusion over play dates? Because this caused a lot of issues today for parents. See, if the HSE saying you should limit the amount of play dates, Simon Harris said, I think, have 1 to 4 people at your play date if you're having it. And then you go on Twitter and you say avoid play dates. So is there mixed messaging coming from the HSE and Department of Health? First of all, are you worried about that? And secondly, what is the definitive on play dates?
So I think what we've said is that if children still continue to mix with other children in the way that they would normally do, then the measures that we've recommended and taken this week won't be as effective as we want them to be. But our recommendations are not absolutist. Children still need to have a normal life, and we recognise that. So children still will play with other children. What we're asking, though, is that in as much as it is possible, people, whether they're adults or children, reduce their level of social contact and reduce their discretionary social contact. So children can still play outside, they can still play in small groups, but what we don't want is big groups of children getting together like they would on the summer holidays, for example. So yes, children can still play together, and it's not absolutist.
Doctor, I know that there was an awful lot of fear spreading, should I say, earlier about what might happen on Monday in terms of a status red event. I know that there was a minister earlier that pretty much rubbished that, but it's certainly in the minds of an awful lot of people. The last 2 days have seen the biggest increases of people diagnosed with this in this country. So, I mean, has it been discussed, or how likely do you think it is that we may, if not come to a status red lockdown, something similar, something close to that?
So I've heard those rumours, including from my own family. They're not true. This is not part of our plan. This is not a lockdown situation. It's advice and guidance to the public around restricting the majority of social movements, measures focused on the workplace to, in as far as is practical and possible within certain workplaces, to reduce social contacts, to facilitate meetings at home, video conferencing and so on, to continue normal economic and workplace activity, while at the same time maintaining in as much as possible the kind of social distance that we're recommending, and then also the message in relation to vulnerable groups. And then we apply that obviously to schools and to mass gatherings in the way that we've outlined. We think that's a set of practical measures that will obviously create a challenge. They'll impact individuals in their normal family life, in their community life, in their working lives, but it's not a lockdown situation. I'll say that clearly and emphatically. We are not locking down the country. We have no plan to lock down the country. I've heard rumours of soldiers and Gardaí and things like that in the street. We have no plan to do anything like that.
So again, the science around this is still evolving. There's been a small number of case reports, particularly from China, where it appears that a small number of people who had been infected recovered and then appeared to be reinfected. But it's quite unclear at the moment whether that in fact was the case or if they just hadn't fully recovered from the initial illness in the first instance. So no, we don't have a definitive evidential position on that at the moment. It's still under review as more and more evidence comes out.
Dr. Henry.
Maybe I could help. The pattern of the illness, as we learn more about it, especially from China or Italy, the pattern of the illness in the more severe type of illness, which is a minority of cases, makes it appear as if people become ill and get better and get ill again. But in fact, what happens is they have what's called a prodromal period, during which they have mild, moderate symptoms. And for those small proportion of people who become very unwell, days 8 or 9, they could become more severely unwell. So this may appear like reinfection, when in fact it's part of the same disease course.
And I think there's a question that's related to that, which we don't fully know yet. What level of immunity is conferred on an individual who's been infected after one infection? That's something that's still an unknown.
Hi, good evening. I wondered, has the Department or HSC been investigating how to get Irish patients quick access onto clinical trials? And do any Irish patients have access to remdesivir? I just have one other separate question as well. Could it be clarified if contacts of confirmed cases can be legally isolated?
Just in answer to your first question, there are no known effective treatments for this virus. It's a new virus for which there's no immunity in the population. And as we all know now, there's no vaccine and no prospect of one for a long time. But yes, of course, there are trials. But bear in mind, we have a very short experience of this medication in a very long time. And there's some early trials taking place in the United States and elsewhere. And we have a national lead, Professor Colin Bergen in St James's Hospital, who's advising us and advising NEFIT through its medicine subgroup on the course of these trials and any participation for patients within these trials. So yes, it's something we're engaged with, but bear in mind it's a new disease, very early on its course. Normally when we look at effective treatments in medicine and look at evidence base, it goes through a rigorous process of randomized controlled trials and the assessment of the relative harm and benefits of a drug. And in this particular disease, in this particular virus, we have such a short experience. My guess is before we have rigorous evidence, it's going to be some time.
And just on the question of I'm understanding you to say that contacts to be essentially against their will detained. Is that the I can't hear you now. Sorry.
I believe the director of the Health Protection Surveillance Centre raised this issue in 2015, that there was no legal framework to actually enforce isolation of a contact if that need arises.
So there is a legal power now specific to COVID, which provides for, in the context of a probable source of infection, the power exists for a person to be detained against their will. In relation to contacts, we have no specific power in relation to that, but we have no reason to believe that we have a problem in terms of compliance or cooperation on the part of contacts. There's been extensive experience with this particular disease now in contact tracing, in advising contacts around the measures that need to be taken, particularly close contacts around restriction of movements, and we haven't experienced a challenge. And I think in talking about these measures, we haven't required to use them, as has been the case really for most of the life of these measures and their existence on the statute books, because for the most part, people do comply and work with the advice and the guidance of either clinical or public health professionals. And that's what we're observing in this particular situation. And as I've said really since the beginning, the most important part of our response to this is an informed public and individual who understands the nature of symptoms, understands what's being asked of them and what's been recommended to them, and how to develop, if you like, an understanding of how best to use the healthcare system and to manage their own illness. If we don't have a cooperative and willing, if you like, public and collection of individuals, we don't have a good strategy in terms of managing the disease. So I want to emphasise that as the most important thing. We don't really believe that we need to be deploying legal powers in order to get the kind of compliance we're recommending.
There's a lot of focus on children and play days today, but it's Friday night tonight. Is there any reason for a nightclub to be open this evening? And if there is, how should they moderate their activity?
in terms of need, the need is probably as great at any time for a nightclub to be open. It's a question of whether a nightclub can continue to function while maintaining the social distancing guidelines. Those are the guidelines that exist now, and that we're advising the public. So the action, I think, for us is about empowering an individual to make a decision about maintaining their own distance from the kinds of activities that would involve close and ongoing social contact with other people. And that's what we're advising people to do. It may well be the case that a number of nightclubs stay open and provide an opportunity for people to visit while I know that there are some that are looking at ways in which they might be able to comply with the guidelines while still operating. We're not asking nightclubs to not operate. We're not asking nightclubs to close. We're asking individuals to understand the nature of our recommendations, what they mean for them in their daily social activities, and to empower them to decide which social activities they need to avoid and how best to do that. So our guidance would mean that, like, a nightclub and that kind of activity for an individual in the way that would normally operate would involve close and ongoing social contact, would for the most part be a setting.
You're asking small children not to mix with more than 3 or 4 of their friends, and yet you're not asking nightclubs with loud music where you have to shout into somebody's ear not to close down or radically change
in each of the cases that you're identifying there, we're asking we're focusing on individual behaviours. So in the example that you've given there.
Can I ask another question? The Taoiseach said several times during the week that we can't stop this virus, but we can slow its spread. And I wasn't here last night, but the curves were there, and we're talking about flattening the curve and pushing it forward. But when you look at the area under the curve, it's the same on both curves, isn't it? So does that mean that the measures that have been introduced and the things we're trying to do won't make any difference to the number of people who will eventually contract this disease, but will only serve that they contract it over a longer period of time and help the health service to cope with it?
So that's not fully known, and the way the diagrams that you're referring to there are about helping us to explain conceptually what the strategy is about spreading over a period of time. But you're right to say that if the area under the 2 curves is exactly the same, that implies that the same percentage of the population might be affected. What we're trying to say, even if that was the situation, and it's impossible to know for sure on the basis of the science and evidence what that final percentage will be, that's one of the questions we'll be addressing through the modelling work that we're doing now. It is still the case that the more we can deploy strategies that stretch this out, the more we can assure ourselves that the impact of this can be minimised at a point in time, that the height of the peak at any point in time will be as low as possible, and give our health services in particular and our public services generally the greatest opportunity to manage and to cope with the impact of this.
So are you saying that at the moment you don't know how many fewer people will contract the disease as a result of the measures taken?
So we can project that we think that these measures will have an impact in terms of stretching out. The question that slowing down and stretching out the spread, that'd be a longer experience, a lower peak. But what the total number of people to be affected in either one strategy or the other, it's difficult to be precise and to say that the percentage will be the same or less in one situation versus the other.
So again, you're saying you don't know what impact the measures will have in terms of reducing the number of people who might eventually contract the disease.
So that's not something that any part of the world knows at this moment in time. So the question is, the experience of a wave in a population could be changed by it, but it might not impact the overall number of people who are impacted. So one of the questions, as I say, that our modelling work will be focused on, to try to build a model with the team that I outlined. You weren't here last night, Paul, chaired by Professor Nolan, with a number of mathematicians and others adding to our standing, if you like, capacity in terms of disease modelling, to help us to understand what our experience of the disease is based on our contact tracing, and to project forward what we think our experience is going to be at any point in time as we go through this, and what the ongoing impact of the measures that we're taking will be.
And do you agree with the Taoiseach that it can't be stopped, but it can be slowed? Because I think the head of the WHO has said it can be stopped.
Yes, I do agree with the Taoiseach. And the measures that we've deployed here, the evidence, if you like, that exists in relation to the impact of those measures is mostly evidence derived from influenza and influenza forward planning and so on. This is a new disease. The experience of countries with this disease, the modelling of all of that is still at a very early stage in its evolution and our understanding of it. And that's why we still have considerable uncertainty about these models. They're still based on features of this disease, like the length of time that people can continue to be infective after onset of symptoms and after resolution of symptoms, the extent to which it can be transmitted prior to onset of symptoms, and so on. Case fatality rates I've mentioned. There are a number of uncertainties that would still that still need to be answered for us to be more precise about the kinds of questions that you're asking. So it's the limitations of the understanding of the virus and its behaviour that prevent us from being able to be absolutely certain about some of those questions.
Tony, just to follow up then, just in terms of the modelling, you did say earlier on the week that the modelling would be updated towards the end of the week. It was widely reported on Sunday that it was a view in the HSE that as many as 1.9 million people in Ireland could contract this disease. Is there any update on that? Is that something which is still in play, that sort of figure?
So that figure hasn't come from any modelling work here. It was a figure that was generated from, I believe, some work in the UK. But we're not in a position to say, I think as the CEO of the HSE said when asked the direct question, will that be the experience, will that be the number? We're not in a position to say that it will not be. Colin?
Just as Tony says, that's incomplete. We're playing our own modelling situation here. But when we focus on figures such as this, it distracts us from what we can do right now to reduce the impact of the virus in the population. So, because when we talk about figures such as this, it brings us into a situation where we're planning for really something that no healthcare system could deal with. So, in my view, it's helpful to. It is a distraction from what we can do right now to reduce the impact of this virus in our population and how we can prevent an additional burden on our healthcare system.
What's the biggest cluster of people who've travelled back, who are now tested positive for this? I mean, in terms of numbers, if a group of people have come back from an affected region, what's the biggest number of people who've come back in one group who have now been confirmed cases?
Just the number you're looking for, is
that
right? I think 11, is that right?
In terms of travel-associated cases, we have had one large group of about 16 people who come from a particular area.
And 11 of them were confirmed cases?
No, I think at this point we have about 16 cases who have come from a particular affected area.
Just one more for me then. Just in terms of severity, one of the experiences recorded in Italy is that due to the stresses in their intensive care units, they've had to prioritise treatment for people in their 20s and 30s over 40-year-olds due to the intensity of these cases. Is there any update in terms of the science on this, in terms of is it the experience of other countries, is it stronger than it was initially believed to be?
On the ethical framework of how doctors make decision making, there's a strong ethical framework from the medical council and from that applies not just in Ireland but internationally, the same set of principles. So clearly in the Italian situation, it's important to emphasise we're looking at figures there on the impact of the virus where the countermeasures and the containment wasn't successful or wasn't perhaps not implemented in time to prevent the way the virus has affected the population and healthcare system. In our own country, we recognise that should our healthcare system be impacted in a similar way or even to a smaller way, doctors and nurses and healthcare staff will have to make the best decisions they can in any one set of circumstances. I personally wouldn't agree that should be based on age, and I don't think any doctor would. The primary requirement of whether determination of whether somebody needs one type of care or another is their need and clinical prioritisation. And it's important to emphasise that before anyone gets to that stage of critical care, there's a lot of steps that can be taken that are of a less interventional nature that can mitigate and obviate the need for intensive care. But again, to put the measure, I want to re-emphasise the point because clearly people are looking at Italy and China and looking at the experience there, and it is frightening for people when they look at the impact that could have on our healthcare system. But it doesn't have to be that way. There are still elements within our control, and those elements are the new advice that came out yesterday, the social distancing, along with the personal protective hygiene. These are measures that will blunt the impact of this virus in society and will mitigate the effect it has on our acute healthcare system.
Could I ask, is the correct number, or the complete number 91 rather than 90? Are you excluding the person who died from the tally? No, it's definitely 90, is it?
So the total number as of noon today, which as we outlined last week, that would be our update, is 90.
Okay, fair enough. Okay. Could I just say, the other activities here that children might, as opposed to play groups, just maybe playgrounds and also matches. Where would you stand on those? Now that the...
So I know that a number of sporting organisations have responded and issued some guidance. We'd be anxious to try to help sporting organisations in the interpretation and guidance that they might issue in relation to some of the activities that would be happening in local communities. We are doing work with the Department of Children and Youth Affairs to provide guidance in relation to childcare settings and so on, because I know there are genuine questions that have arisen for people and for parents around some of those things, and we'll be keen to provide that. And we will be trying to provide some later this evening guidance for parents in relation to some of those very practical questions that you're asking now around children, and we should be in a position to place that on our website this evening.
Earlier on this afternoon, the World Health Organization and Dr. Tedros have made a statement to say that, in general, Europe is at the epicenter of this outbreak, with more confirmed cases daily than the rest of the world put together, except for China. How concerned are you that these measures that were implemented yesterday, up to the end of the month, how concerned are you that might have to be extended, whether, schools remaining closed, sports clubs remaining closed, all of that kind of thing, that this might have to be extended further? As I mentioned earlier, the cases are only growing on a daily basis here.
Yeah, so the cases are increasing, and that was part of the reason that we said we would monitor this disease and take action swiftly. That's been the advice of the ECDC this week, and that informed the comprehensive nature of the range of measures that we recommended and that were implemented as and from today. In terms of the review of those, I've said we'll keep that under constant review. At this point in time, we can say what our position will be as we approach the end of that time period, and whether we continue to recommend their use. That will depend on what we see in terms of the disease. The WHO is identifying, obviously, in particular the north of Italy, as a significant source of infection, which is exporting cases throughout Europe, and has led a broad range of European countries to take significant countermeasure steps that are broadly comparable to the measures that we've now taken.